Why does osteomalacia bone look different microscopically? Imagine looking at a tiny piece of bone under a microscope. You might notice some unusual features that set osteomalacia apart from other bone conditions. And like osteoporosis, which mainly involves losing bone mass, osteomalacia is all about how the bone mineralizes. This means the process of turning the organic bone matrix into hard, mineralized bone is disrupted. The most striking microscopic feature of osteomalacia is the presence of abnormally thick layers of unmineralized bone matrix called osteoid seams. Normally, osteoid is a thin layer, less than 12.5 micrometers thick. But in osteomalacia, these seams become much thicker because the bone is laid down but never properly mineralized. Think of it like laying bricks without cement. There's plenty of material, but it never hardens into solid, durable bone. Another key feature is a prolonged mineralization lag time. This is the delay between when the bone matrix is formed and when it actually becomes mineralized with calcium and phosphate. In healthy bones, this process takes around 100 days or less. But in osteomalacia, this delay can stretch beyond that, sometimes approaching infinity in severe cases. That means the bone matrix remains unmineralized for so long that it essentially never hardens, which explains why the bones are weak and soft. Doctors can also use special fluorescent dyes called tetracycline to see how active mineralization is. In healthy bones, tetracycline binds to areas where mineralization is happening, creating a bright pattern under the microscope. In osteomalacia, there is little to no tetracycline uptake, indicating that mineralization is minimal or absent. In the worst cases, no tetracycline binds at all, confirming that mineralization has essentially stopped. The pattern of bone turnover, which is how quickly new bone is formed and old bone is resorbed, varies depending on the cause of osteomalacia. For example, in vitamin D deficiency, the activity of cells that build and break down bone is often increased. But despite this increased activity, the new bone fails to mineralize properly. This is a big difference from osteoporosis, where the problem is mainly a loss of bone volume, not a defect in mineralization. Histomorphometry, a detailed way to analyze bone tissue, looks at three things: how much bone is being turned over, how well it is mineralizing, and the overall volume of bone. In osteomalacia, mineralization is always abnormal. Bone turnover and volume can vary depending on how long the disease has been present. Early on, bone volume might look normal, but as the disease progresses, the bone can become less dense and more fragile. The time it takes for the organic matrix to mature and become mineralized is also longer in osteomalacia, adding to the bone's weakness. Understanding these microscopic differences helps us see that osteomalacia is fundamentally a problem with mineralization, not just bone loss. While osteoporosis involves losing bone mass, osteomalacia involves bones that are there but not properly hardened. This is why treatment focuses on correcting the mineral deficiency by restoring vitamin D, calcium, and phosphate levels. So, in essence, the microscopic look of osteomalacia bones reveals a buildup of unmineralized matrix, delayed or absent mineralization, and variable bone volume, all caused by biochemical issues with mineral availability. These features are key to diagnosing the condition and guiding effective treatment. Always remember, if you suspect any bone health issues, consult with a healthcare professional for proper testing and personalized advice.